We have started our journey and we decided to improve our service for our young people living with high HbA1c. We consider the highest one above 70 millimoles. By doing this, we have considered that our unit is one of the units in Southwest with high number of patients, especially age 16 to 19, and that's because our patients are in transition as soon as they are turning 19 years of age. We did have difficult times due to the lack of engagement with diabetes team and also poor control of diabetes over the years. So we have tried to identify possible and contributing factors like social issues or isolation or psychology needs. Unfortunately, when we decided to do this project, I think after the first session, we have lost our psychology support completely, and we have not got one since. But through our journey, we have designed and learned how to create a patient-sensitive survey. And we had a very positive feedback on our team from patient survey with a willingness to make changes of 70% respondents. We also the responses of our survey helps us to have a better insight into motivational factors and barriers, which could lead to constructive changes and improvement of long-term control. Also, the survey has helped us to develop new little QI projects and implement new changes to our clinics and to our patients. So we looked back to, for example, when we started educating our patients as soon as they are coming with a newly diagnosed symptoms, then we started using the app with the resource pack they have provided. And also we are doing carb counting refresher, especially for those with poor control and especially teenagers. We have managed to improve our clinic communications, and we have designed a patient priority questionnaire, and basically patients are telling us what they want to discuss in the clinic. We have reorganized our children's ward education, and we just started using Digibet, which will provide more support and also improve the clinic appointments. We also reorganized our pump processes, and we have implemented a pump pathway with a contract and education. We do hope the education will be in group sessions, but those can be at the moment are just individual sessions. We looked at the technology, and as our patients are using the flash glucose monitoring or DIASN downloading at home or CGM monitoring, we have encouraged all of them to download those at home, especially in the last 6 months and during the COVID time. And I must say, a very good percentage of our patients, they are managing to do this downloading at home, and this is very encouraging for our team. So when we started our project trying to reduce the HbA1c, we have thought that we will achieve this by exploring the attitudes and identifying the support, and with tailored education and adopting a new technology or appropriate technology for our patients, this will improve the long-term control. Our journey or our design high HbA1c pathway will have 6 points. So first we have the consultant who is going to review the current treatment clinic, fortnightly contact with a chosen member of MDT, support with meters and pump downloadings, and this will be fortnightly. An offer to an appointment for a carb counting refresher. We will consider normally a clinical psychology referral, but as I said at the moment, we do not have one. And a face-to-face clinic review every 6 weeks. I must say, during the COVID time, we have not stopped our clinics at all. We have just adapted to the telephone consultations clinic, and we have managed to bring those with very poor control face to face. So regarding our interventions, we have designed a young people questionnaire, and then they could identify 2 things they want to discuss that will provide their priorities for our clinic's review. We will try to keep to time, and I think this has been one of our problems, but it is improving already. As I already expressed, our high HbA1c pathway will involve a discussion with the consultant and identifying possible barriers to compliance, and at least 2 ways of expectation and support of our patients. Our future actions or plans will involve implementing this high HbA1c pathway, finding new ways of working as a team, or opportunities for further patient education within the MDT clinics, further development of dietitians resources for education, and having technology implementation group, pump, or other online supports. And I think that's all from Yeovil.